episode, we interviewed a good friend, Dr. Jose. He's currently working in Sacramento, California, and dealing with the whole COVID-19 situation. We wanted to get his insight and also grab some tips on how to stay safe and healthy during these hard times. Please don't forget to comment, like, and subscribe. And I hope you enjoy this video.
All right, guys, thanks for joining in. We're here with Dr. Jose, who is a doctor at UC Davis Hospital in Sacramento, California. And want to start off by saying thank you for, separating some time to be here with us. And also want to tell you that we appreciate everything that you're doing right now, because we know you're, on the front lines of all this situation. So thanks for being on, man.
Oh, it was my pleasure.
Get started here by asking you some questions and kind of want to know a little bit about yourself too. How long have you been dealing with seeing patients and things like that right now?
So, I started this year. So I'm a first-year intern at UC Davis. I have about 8-9 months of experience now of actually seeing patients as a doctor. I've had about 4 years of medical school prior to this. And in that training, we probably saw patients during the last 2.5 years of our training as well.
Okay. And how do you like it so far? How has it met your expectations? Has it surpassed them?
It's been an amazing journey, I'll tell you that for sure. There's been hard times and great times. It's definitely overwhelming with the amount of hours that we tend to work, but there's so much joy in the actual pleasure of doing the work itself that it makes up for it in the long run.
For sure, man. And how has the situation been hyped up now that you're in the middle of this crisis?
So when things first started, at least from my experience, it was very overwhelming just because there was so much that was uncertain about the whole process. It was very little known as to what symptoms people presented with. We knew that it presented like a cold type virus picture. People were having difficulty with breathing. People were getting worse over the course of their time. What we noticed is that at certain points, like 7 days out, people started getting a lot more sicker than you would normally see with any other flu or any other cold.
Okay.
The issue we were having was that we, as a whole country, weren't really prepared to test for this. We were aware from things that were happening in China, but a lot of things took a very long time to develop testing to make sure that the patients that were coming in for respiratory symptoms were actually positive for this new virus.
And what's the current testing situation now? Are you guys short on them? Are you guys meeting the expectations of how many people are coming in? What's the testing situation right now?
So currently we're actually testing, we're capable to test about 400 people at least at our hospital per day. Okay. We're not reaching those numbers just yet. Right now, we feel confident we can test about 200 patients pretty easily. We get patients every night complaining of respiratory symptoms. Everyone gets tested coming in. Our turnaround time for testing is right now, it's about 24 hours. The good thing is the test actually has a really good sensitivity as well as a good specificity that allows us to be pretty certain that if you actually do test positive, you have this. If you test negative, you most likely don't have the virus.
So it's pretty accurate then, like no one goes home doubting if the test was, wrong or something like that.
Exactly. If it was done properly the first time, and the way it's done is you do a nasal swab, you have to go pretty far in your nose to get the sample. As long as the actual action is done correctly, then yes, the test results are pretty sensitive and specific.
Okay, awesome. And what about in regards to equipment and things like that? Like, were you guys prepared? Do you guys have enough right now? Are you guys on shortage? What's the equipment situation?
Yeah, so we're pretty much on shortage. Most people, the way that when they first presented, we had to do airborne precautions for a lot of our patients. By airborne precautions, there are two different ways of doing it here. Is we either use an N95 mask, you can use a respirator as well, or you can use something called a PAPR, which is just pretty much like a full helmet suit connected to a vacuum that helps suction and filter the air coming in and out. What we were noticing is we did have quite a shortage of N95s first, just because they're more simple masks to wear, and we started relying more heavily on the PAPR equipment. PAPRs are more reusable, so we were trying to get the most we could from that equipment. What we're having now is we're actually starting to have more of a shortage on the PAPRs themselves.
Wow. And how do you feel personally? Like, do you feel like do you walk around feel protected, or do you sometimes feel like, man, maybe I'm at risk? How do you feel personally?
Well, the thing is, like right now, I'm currently rotating through the ED, so we're getting a lot of like the firsthand experience with a lot of these patients that come in, short of breath. Everyone who comes in, we're suspecting that they have coronavirus.
Okay.
So unless someone needs a aerosolizing procedure, such as requiring pressure ventilation, or they're going to be intubated anytime soon, or they're going to require nebulizing treatment, they don't need to be on airborne precautions anymore. So now we just are doing droplet precautions, which is just a simple surgical mask, as well as contact precautions, which is a gown. So as long as you walk into those rooms with those equipments, I feel pretty safe walking into those rooms. We wash our hands going in and out, again, prior and after leaving the room. Again, it's probably the best thing in sense to protect yourself from this virus.
Yeah. And what about staff? Like, have you seen a decrease in the amount of staff working, or has it been pretty stable?
It's been pretty stable. I mean, we've had people who have come in and out of the hospital for coronavirus rule outs. I was ruled out during my ICU rotation here.
Okay. So that's good. And this kind of segues into the next question, because I guess, you know, a lot of people are self-quarantined at home, and it's been recommended by a lot of local authorities. What do you think about in regards of like going to the stores, or, you know, going out and about, like living your life normally?
I think people should stop doing this. No, I mean, it's a necessity for you to go to the store, pick up groceries, just buy things in bulk right away, and try to limit your exposure to other people. I mean, this virus is pretty contagious. That's the issue we're having. It affects a certain population more than other people. So it affects immunocompromised people. It affects the elderly a little bit more, just because they're more, again, their immune system is a lot weaker. As a young person, if you get the virus, you'll most likely be okay. Some people will get worsening of their conditions from that. But if you limiting your exposure to the disease by going out and then infecting other people around you, knowing that they potentially could be immunocompromised, you're just making the situation worse. It's not so much that we're doing this to protect ourselves, we're doing it to protect the more vulnerable people in our population.
Yeah, because I mean, it's not only about you getting it, but the fact that you might not have it, but you're definitely a transmitter, so you're spreading it, right?
Exactly. Everyone ends up becoming a human vector. But try to limit your exposure to the outside environment. Unless you really need to go out, it would be very judicious to stay home. Right now, at least in other areas besides New York and Los Angeles, the amount of patients that are presumed to come in as a mass storm haven't reached their peaks yet. So we're expecting around May, late April, for this surge of patients to come into the hospital for worsening respiratory symptoms concerning for coronavirus.
So there's still you guys are still expecting a peak of people coming in. So if there's a time to stay in and avoid going out, it would be now then, pretty much. And for those people that do have to go out, noting that you said that there's a shortage of some of the supplies, would you recommend they wear masks, gloves? Like, are those things actually effective?
So as I mentioned, like what we do in the hospital for a lot of patients that come in, we do contact and droplet precautions. In the hospital, that consists of a gown, gloves, and a surgical mask. CDC believe back and forth there's recommendations between wearing masks outside in public versus not wearing masks. It just depends on who you ask. I think if you are in a household that has people who are immunocompromised, I think it's reasonable for you to consider wearing a mask. And as far as gloves go, if you think about the purpose of gloves and how we use them in a hospital, we go into a room, put gloves in, we leave the room, we take our gloves off. We wash our hands before and after. If you're going all day with the same pair of gloves, you're not really making much of a difference in terms of what you're doing in terms of contact. You're still touching the same surfaces, whether it's on a glove or your hand. The more judicious thing would be to wash your hands more frequently. I don't think gloves are actually necessary for you to try to prevent this virus from you getting exposed to this virus.
Okay, for sure. And in regards to, I know there's a lot of things being thrown out, like, for immunity boosting, self-medication, things like that. I know that there's something that even I think the government is pushing. Some people in the government are pushing, like the hydrochlorine, something like that. Like, do you recommend people taking stuff like that, or what would you recommend to like boost your immunity, things like that?
Well, I mean, there's always been that thought that people who have like a flu, in order to prevent it, you take high quantities of vitamin C, but there's no real evidence that actually supports that. A lot of people who end up taking a lot more vitamins, if you eat a pretty balanced meal overall, you wouldn't even need to take a multivitamin supplement. So I think it's more just being able to eat a balanced meal and get plenty of fruits and vegetables, get plenty of protein. If you do that right from the beginning, you actually wouldn't even need to take multivitamins.
Okay.
And the fact that people are taking huge quantities of vitamins, there's actually toxicity that you can get from taking huge amounts of vitamins themselves, especially more like fat-soluble vitamins like vitamin A. And you were mentioning a medication that the government was pushing. I believe you're talking about Plaquenil or hydroxychloroquine. That's actually an anti-malarial medication. The thought is that it can help try to alleviate the symptoms of the virus. We've used it on a few patients here in the hospital. We're trying to run towards more clinical trials to treat these patients at this time, including medications that we would normally use for like hepatitis B, or medications that potentially could have been used during the SARS or MERS outbreaks.
Okay, so it's not like something that we should be telling people go out and put an order in or tell your doctor to give you that. It's something that's more on a clinical trial base.
Exactly.
Okay, that's pretty good stuff, because all of the information that's being thrown out there, you're getting from left and right. We're getting bombarded, and we kind of want to stay more on the facts, safe side, to kind of promote a healthier lifestyle. And I think right now the best thing we can probably do is stay at home, avoid unnecessarily going out. If you have to, or you take the necessary precautions. One other thing that one of our viewers wanted to know was, do you think it's safe to go out and do exercise? And some of the gyms are closed. Would it be recommended to go, let's say, a park, or here in Utah, or, up to the mountains, and do some exercise up there?
I think the whole point is, like, if you are isolated from other people, I think it's most likely okay to do so. In terms of exercise, I mean, most people can do home exercises. There's a lot of videos you can do on YouTube that actually have pretty decent recommendations for exercises you can do at home. If you need to go outside to go hiking or things like that, I mean, be very judicious with your contact out in the real world, but at the same time, again, isolation is the key here.
Okay, so just keeping your distance and kind of using common sense, and that's to avoid that close contact to spread or transmit to someone else. So definitely keeping that in mind, and we just kind of want to share with our viewers. The important thing here is you might not have the coronavirus, but you can be a transmitter. So the reason why we're asking you to stay indoors is not necessarily, yes, it does help that you probably won't get it, but you might be a carrier and that could infect someone else. Like you were saying, probably an elderly person or someone whose immune system is compromised and is most likely to get it. So, we want to promote self-quarantine to prevent the spread of it. And reiterating what you were saying, we're still expecting a peak in a lot of these cases. So if there's a time to stay in, it's literally right now. So yeah, we appreciate your time coming on, man. I know you're a busy guy. I know you were telling me earlier that your schedule is right now is whatever they tell you, you gotta take it because the circumstances and the situations are varying. But we thank you for coming on, and I know that you have a tough couple of weeks coming up, and we wish you the best, and we're praying for you, man, and we appreciate everything that you're doing, you and everyone else in the front lines right now, because I know it's not easy. You guys also have family. I know you have family, and that's always also a risk. You don't want to cause any harm to them. So we're definitely praying for you and hoping that everything works out for the best. And thank you for everything that you're doing.
Thank you, Pastor Abel. I appreciate it.
You have a good one, brother. We'll stay in touch.
Sounds good.
All right, y'all. Thanks so much for watching to the end of the video. Hope you guys liked it. Hope you guys enjoyed it and found it very informational. Please give it a thumbs up. Please share it. Comment. We would love to see your comments. We would love to respond. So please like, share, and subscribe. And yeah, just stay safe out there, guys. Peace.